Welcome back to the Morning Blend. Well, vein disease can range from cosmetic to deadly. Spider veins are usually just an eyesore, but some vein problems can cause serious swelling infections. Dr. Deborah Mangione is with the Wisconsin Vein Center and MediSpa to tell us more, because March is actually DVT Awareness Month,
right,
which stands for Deep Venous Thrombosis, which we're going to talk about.
Deep vein thrombosis really is the life-threatening problem, because if you have a problem in your deep veins, which are the major veins in your legs returning the blood to the heart and lung, if you start to develop a clot or coagulation of the blood in those veins, what can happen is it can break off and go to your heart. The other major complications are heart and lungs, and so you can actually die from that kind of thing. The other major complications are you can be left with a chronically forever swollen leg if it's not taken care of properly.
What I always wonder with this particular, especially because it's so serious, this vein problem, is there are ways I know you can detect whether or not you have DVT.
Yes.
But can you be aware of whether or not it's going to actually break off and become a problem for you?
No, you can't. And so that's why if you do develop a painful swollen leg, or you have unexplained discomfort in your leg, you really need to have it evaluated. And that frequently means even going to an emergency room. If you have no reason why your leg is hurting, and it is hurting, don't take it lightly, especially if there's swelling involved.
Okay. And just backing up to kind of explain this range a little bit, there are spider veins that tend to be mostly cosmetic,
and those are superficial. There are two sets of veins in the legs. Deep veins underneath your muscles, superficial veins just under the skin and soft tissue, and the spider veins are the least important of those, okay? But then there's a seriousness kind of in a spectrum. You can get varicose veins, which are superficial veins, which become bulgy and have no valves that are working or valves that aren't working, and so the blood tends to pool in the legs. And those are things that we can easily take care of in an office, and that's what really needs to be stressed. None of those things ever have to be taken care of in a hospital again. They can be taken care of in the office under local anesthesia. People can come in and have those things taken care of and walk right out and resume normal activities.
And I think that's the exciting thing about this. I mean, people used to talk about you have to go to the hospital to get veins stripped, whereas now you can go to an office like yours that's absolutely beautiful and do it right there in the office under local anesthetic.
Yes, we can. Now, obviously, those were just some pictures of some of the aesthetic things we do, but we do all kinds of vein procedures in the office, and really 99% of vein problems can be taken care of as an outpatient or in the office. Even a deep vein clot in most people can be handled now with compression stockings and anticoagulants they can inject at home. So very few people have to be hospitalized for any of these problems anymore.
And how do you diagnose a problem? How do you know whether or not it's spider veins, something in between, or something as serious as DVT?
Well, you really need to see a vein specialist or a doctor who can then order an ultrasound if they think there's something more going on than just spider veins. Because an ultrasound really is the diagnostic test that shows us a roadmap of the legs. That's what we tell people. For the superficial veins, for the bulging veins, varicose veins and things, or people who have discomfort in their legs that has been around for months or years, and it's related to standing for long periods of time or whatever, we do ultrasounds right in the office with people standing up so we can see the effects of gravity on their veins. And that's really an important concept, that we want to see what happens when they are standing, so we do see the effects of gravity.
And do you have some tips for prevention of DVT? Because this is something that you can try to prevent, because we always talk about like air travel as being a problem.
And it's spring break time, and so that's one of the reasons I thought it would be good to talk about this right now, because when people are going on any prolonged trips on an airplane, they are at risk for getting a DVT. 1 to 3% of people on any large plane will be getting a deep venous thrombosis over a trip that's 6 to 8 hours long.
It's that common? Just 6 to 8 hours?
Yes, it can be that common. And so we tell people, hydrate. Make sure you drink water for a day or two before you go, and you stay hydrated on the flight. Second thing is, if you can't get up and move around, especially in those, our regular way of travel in the back of the plane, you have to be able to do some exercises where you do heel and toe points. So you're activating the calf muscles of your leg to keep the blood flowing. Okay, because by doing that you're pumping. And so that's the other good thing. And then taking an aspirin before you go is also another good tip, because it just keeps the blood a little bit thinner, prevents those platelets from clumping together and causing any clot.
That's a good tip I've never heard of before. And if you have had DVT, then there are also some things you should do. I didn't realize how long people who've had it should wear compression hose.
And many doctors don't know that either. If you've had DVT and you've had a swollen leg at all during that time, you need to wear graduated compression stocking, a special elastic stocking, for at least a year afterwards in order to prevent that becoming a permanent chronic issue. And the other thing is, we've seen now in very large studies that in that first year, if you can wear a stocking the whole year, you are reducing your risk of getting another deep vein clot in the future.
So you think that's a key? I mean, it's a long time to wear it, but to think that you can reduce the likelihood of it returning, I think is huge. And I think the key is to make sure that you have your vein problems evaluated, especially, as you mentioned, if you have leg pain or acute swelling that's unexplained or it occurs after a long car trip or plane ride, definitely have it checked out. And you can visit the people and get a consultation at Wisconsin Vein Center and MediSpa. They're located in Pewaukee on Georgetown Drive. The phone number is 262-746-9088, or visit the website. It's wimedispa.com.